A common question that many patients have is, how stiff is my neck going to be after a fusion? Most of the range of motion of the neck does not occur in the lower cervical spine. Probably half, maybe even more, occurs at the base of the skull here, where it meets C1 and C2. So the vast majority of surgeries on the cervical spine are done here, lower down. So in essence, as long as your skull and C1 and C2 are normal, most of the motion of your neck is intact. The following case is an example of that, of a man who's been fused from C3, which is here, all the way down to T2. So nearly his entire neck is fused except for the very top. This is the MRI scan of the same patient, sagittal cut. He's a 52-year-old man who presented with severe cervical stenosis. He was unable to use his hands. He was falling. He was grossly myelopathic, which means the spinal cord was damaged. You can see here on the MRI scan, he's had a previous C5 to C7 fusion anteriorly through the front of his neck. You can see the plate and screw artifact. At C7T1, his bones are sliding. He has spondylolisthesis. So the bones are shifting at C7T1 at the very base and compressing his spinal cord. This, I think, was a significant problem because he could not ambulate. And then above his previous fusion from C5 to C7, he had stenosis. This shows you the spinal canal. The middle circle is the spinal cord. You can see there's plenty of room here at C2, C3. This shows at T1 pedicle, he has plenty of room for his spinal cord. It gives you an idea. At C7T1, you can see the stenosis of his cervical spine with compression of the spinal cord. At C3, C4, you see how severe the spinal cord compression is with flattening the spinal cord. At C4, C5, you can see again stenosis on the cervical spine. Now this is his postoperative x-rays. He's fused posteriorly from the backside from C3 all the way to T2. He's solidly fused, and I took out the previous C5 to C7 plate and then took him back 2 weeks later for an anterior cervical fusion at C7T1. Yeah, Oreos, they're having a good year.
Yeah, man.
Okay, this is Mr. DK, and he is status, he's 50, how old are you now? 53? 52-year-old man. He had a C7T1 anterior cervical discectomy infusion and then a posterior cervical C3 to T2 laminectomy infusion October 2012. So it's been now about 7 months. And I just want to show Mr. K's range of motion. So here's a front view. Mr. K, can you turn it, rotate as much? Yeah, that's good. And the other way? Great. Let me just do a side view so you can see. That's a side view and go the other way. Great. And how about bend your neck down, like make your chin and all the way up? Great. And just tell me, you can relax now. Like how do you know you're stiff? Like what things can you not do? Just to tell other people.
Not so much nothing I can't do with my neck.
Right.
I do have a little muscle tension here, because
right.
I think, but I've always carried a lot of muscle tension in there
right.
prior to the accident.
Right, but the stiffness, anything you can't do? I mean, you ride your Harley, you do everything, right?
Just rode my motorcycle this last weekend, 3 days in a row.
Yeah. Okay.
Didn't seem to bother me. Just the old aches and pains from being 53.
Right.
That's about 52. That's about it.
Good. Thanks a lot.
Thank you.